Any other peptides not mentioned that have found to be useful? C-Lank, C-Max, Epitalon, DSIP, those are more brain function, aren't they?
Well, I was going to say, remember that most of the neurodegenerative diseases are brain on fire. They are inflammation of the brain. And so if we're talking about treating the brain, then we talk about TA1 and BPC 157. You know, the research in rats about traumatic brain injury, about stroke, if rats are on BPC 157 before they have their stroke or their injury, absolutely. I love using C-Max and C-Lank in those patients because it's not an injection. So some people are resistant to using injections, especially some of your dementia patients would be really resistant to using injections, but they might tolerate a nasal spray once a day or twice a week, which is the typical protocol for those too. And so we will use those in those patients. There's a lot of things we're going to use in those patients. I'm going to use dihexa because, like you mentioned earlier today, the inflammatory process takes over the way the oligodendrocytes with MS or with dementia, with the way those oligodendrocytes are able to make those axons long and branching. And if we can't get them to function that way or to be that way, then you're going to end up with those neurodegenerative diseases. So if we can decrease that inflammatory process and then add the neurogrowth factors that are in things like cerebrolysin or dihexa or even C-Lank, you're going to find that those patients do much better because they're being properly stimulated.
Loretta Ty says, very interesting. Have you heard of MMS sodium chloride mixed with hydrochloric acid for gut health?
I have
not. There's a lot of stuff out there. There's every day. I'm telling you, people's guts are such a big problem that there are products out there that we've never heard of because you just can't keep up after a while. Let's see here. We have another couple questions here. So Jason, let me see this. I'm having a hard time navigating my screen here. Jason Barkowski. I hope I'm pronouncing it right. I'm sorry, Jay. When starting a peptide protocol like TA1 along with BPC, if you had to stop TA1 protocol for a few days due to the prescription delayed from pharmacy, would it be better to wait until you have enough to complete the protocol or go ahead and start both to get the healing process started?
I would first of all say that depends on the patient, but I'm going to always lean towards let's go ahead and get you started because you're miserable. You're not coming to see me because you feel great. You're coming to see me because you don't feel well. So let's get the process started. And we actually keep a lot of them in our office so that I can just hand it to you when you walk out the door. And I'm usually going ahead and ordering another supply when you leave the office for your next purchase because you're going to need it, especially when we're doing a fairly high loading dose to begin with. And then we're dropping down later, you're going to, that higher initial dose, you're going to need to replace the bottle quickly. So I'm starting you as quickly as I can. And then, so I would suggest that you do go ahead and get started. I think you probably can't go wrong with using BPC or TA1 if you have an autoimmune disorder to start with. I can tell you story after patients doing well with those, even just one of the two of them.
How many of your patients start a protocol and experience Herxheimer and go, something's wrong, I feel horrible, I feel like I've got the flu for the past couple of days?
So you can usually tell who those patients are going to be. That commonly will happen if you start them on something like LL37 too early. But you're going to usually know them ahead of time because they're going to be the patients who can't tolerate perfume smells. They have a lot of food allergies. They have where they go into a room and they can smell the mold in the room. You're going to have, these patients are going to be, they're going to present to you as multiple chemical sensitive. And those are the patients I'm going to start half dose. I'll tell them what the full dose is and I start them half and I give them the flexibility to increase their dose over a certain number of days to weeks. I stay in pretty close contact with them. They all have my cell phone, so